Hello, friends. Doctors and healthcare professionals spend their lives diagnosing illness, yet they are still human. After long shifts, lack of sleep, and constant stress, doctors and healthcare professionals may diagnose their own unusual symptoms and may attribute it to fatigue or migraine instead of something more serious. One condition that can occasionally present with symptoms similar to migraine is stroke. Stroke symptoms don't always appear exactly as portrayed in movies. Sudden weakness, numbness, speech difficulty, vision changes, loss of balance, or an unusual severe headache all deserve immediate medical attention. Most headaches are not strokes, but when neurological symptoms appear suddenly or feel different from your usual pattern, every minute matters. The goal isn't criticizing self diagnosis. The goal is recognizing warning signs early and seeking urgent medical care. If you would like to learn how diagnostic reasoning works and how patients can communicate symptoms more effectively, join my free Misdiagnosis Masterclass. Thank you.